I chose healthcare because I love people. I love to make them happy. I love seeing their smiling faces.
I initially started out thinking I wanted to be a lab technician like my mom, but the more chemistry type classes I started taking, I thought I don't want to be stuck in a lab, so I looked for a profession that I could have patient contact.
I'm a huge STEM nerd. Medical science and everything is super fascinating to me, and I wanted to do something that helped people, and so going into the medical field was just the only way.
You really do feel like you're helping people and making an impact.
This is a job and industry that's going to really give you a lot of non-monetary compensation. You get a lot of personal satisfaction from being someone that can be relied upon.
The feedback that I get from the families about the care that's being provided probably means the most to me.
Every day you could probably pick something different that you're proud of.
It's a really good field to go into.
Healthcare is definitely a growing field. I think especially as the baby boomers are aging, there's more need for healthcare.
Nurses have been in short supply for a long time, but this is going to ripple through the entire healthcare environment.
There's such a broad range and spectrum that truly there's something for everyone.
If you're a people person, there's opportunities in social work and nursing. If you're more of a research person and you're into numbers, you can do clinical research.
There's behind the scenes if you want to just crunch numbers and deal with insurances.
For senior care, huge facilities are in great need of certified nursing assistants.
That doesn't even begin to scratch the surface.
The more you further your education, that allows you to go into more specialized care.
With just a few more hours of training, you can bump up your certificate. Your job possibilities expand exponentially.
It just depends on how much you want to put into it and where you want to take it.
You have to be smart, you have to be quick on your feet, but you also have to be compassionate and patient.
You need to be driven, self-starter, very motivated.
But you also need to be able to connect with somebody.
If you don't have a heart in this industry, it's not even an industry, it's healthcare. You gotta have a heart if you want to work in this field.
Because it's not easy, it's a difficult job, but it's about helping people.
And if you do have an interest, go to a school and get your certificate.
And CNA school is not a huge big deal, it's not a year. It took about 2.5 weeks, and through your clinicals, you'll see if this is something that's gonna work for you or not, and you'll get the experience either way.
So it's a short-term investment with long-term opportunities and very little downsides.
To see the difference you could make in an individual's life is amazing. And I don't see anywhere that you're more able to do so than as a nurse.
People do matter, and we're there to help them heal and help them continue to move on to the lives that they want to live.
Makes you feel good inside as a person and gives you purpose and meaning.
There's no part about it that's not rewarding.
That's what we're here for. That's why we get out of bed in the morning and come into work.
So for stability, for middle-class income, and to feel good about what you do every day, I'd recommend healthcare to anybody considering it.
It's going to be the best job that you've ever had and the best industry that you're ever going to be in.
It's what we live for.